are up and rolling.
Good.
Okay. So, yeah, it looks like we have a pretty good audience already. You guys had such great questions. Thank you so much. I can't wait to talk through all of these.
Yeah, and there's a little bit of a delay, so this is kind of getting with me a little bit. I think we're in sync on Instagram, and Facebook is a little late. That's okay.
Okay, awesome. And does everything look good on Facebook from your end?
Looks great. You look beautiful.
Oh, so do you. Thank you. Thank you so much, Taylor, for inviting me.
Yes.
Okay, so I took some notes. I want to make this really value-packed, and I see everybody's highs and things coming through. So if you have questions as we're talking, just shoot a comment over there, and if it makes sense to talk to it at that point, I'll do that. Otherwise, we'll just hold them for the end.
Perfect.
And so is there anything you want to say, Taylor, before we dive in?
Oh my gosh. First of all, I'm just so thankful that you are doing this. Is it weird that they can hear me in Facebook in my group? You guys, we are broadcasting from Instagram and Facebook at the same time. Are you going to show them?
Oh, I should.
Oh yeah. Yep.
There we go. So if you want to see Taylor's beautiful face, hop over to Instagram.
You guys, Ashley she's a gut health expert. I've been following her for a while now, and I'm just so thankful that she has decided to do this with us. I just popped up on Facebook. That's so funny. So, anyways, you guys, if you have any questions, be popping them out. I'm going to watch Facebook and be live with her on Instagram. So I'm going to be right there with you. Since Facebook doesn't allow dual lives anymore, we're going to do this way.
Awesome. So I just want to start with sharing a survey from 2018 that found that out of, eyes are watering, that out of 71,000 Americans, 61% had a gut symptom the week prior about some gut symptoms. So if you're struggling with gut health issues, just know you're not alone. And I'm really hoping that we can help clarify some of these questions today. And then just as a disclaimer, this isn't medical advice. I can't possibly know your medical history. So just please always check with your main healthcare provider before starting anything new. All right, so one of the first questions is, does your gut health affect all the other functions in your body? And I thought this would be a really great one to start with. So the founder, or he's said to be the founder of modern medicine, Hippocrates, has said it all starts in the gut. And we're really finding that to be true. A lot of this research on gut health has really increased in the 1990s, and it's just exploding now. We know that 70% of the immune system is in the gut, and we actually have 100 times the number of microbial genes as human genes. So it's pretty wild. There's a few pounds of bacteria in our gut, and it's also thought that the gut sends signals to the brain 9 times more often than the brain down to the gut. So a lot of times people...
I think it's the most misunderstood piece of health. I think people don't even consider this when they have a skin issue or anything.
Yeah, and some of you might know my story, but I had severe acne when I was in 6th grade, and then for 10 years was on and off a lot of antibiotics for the acne, and then of course had a lot of gut issues after that. And I really wonder what would have happened back in 6th grade if I would have had access to some of this functional nutrition knowledge.
Mm-hmm. That's amazing.
I'm
so excited.
Yeah.
Look at all these people joining us. This is nuts.
Oh, this is so fun. All right, so we'll talk a little bit later about more kind of specific diseases, but really with 70% of the immune system in the gut, we're finding that a lot of these chronic inflammatory diseases have at least a component related to gut health. And so what are the main symptoms people could look for to identify a potential gut issue? Also, what are the main signs of a healthy or healed gut? thought this would be a good second one because I have come to realize that a lot of people don't know what healthy bowel habits are, because honestly, a lot of times we're not talking about this with people. And so I just want to set kind of a foundation and talk about what healthy digestion actually is. So it is 1 to 3 bowel movements a day. And if you know about the Bristol stool chart, or if you don't, just do a quick Google search, and it should be a 3 to 4 in a Bristol stool chart. So in Chinese medicine, they say it should look like a snake. It should be formed, soft, brown, easy to pass. You shouldn't have a lot of discomfort or pain or cramping, and you should feel relieved after finishing. And so if somebody's having excessive gas, like some gas can be normal, but excessive and, getting worse during the day, odorous stool, overly odorous stool, a lot of bloating where they're looking, pregnant by the end of the day, constipation, diarrhea, abdominal pain, and symptoms like that, then that would be good clues that we should dig a little bit deeper and see what the root causes might be causing those symptoms. And then also autoimmune issues, since 70% of the immune system is in the gut. If somebody has an autoimmune issue, it's definitely worthwhile doing some workup on the gut to make sure that's optimized. And so we certainly can do some lab testing to look into the gut and how healthy it is. And I think that's always indicated, but just trying to give you some practical advice that you can use at home is look at that Bristol stool chart and then just think through everything else mentioned.
And you work with people virtually too, don't you?
Yeah, we've been virtual since I started my clinic. So over 4 years ago, we've been doing telemedicine. So now the initial appointment, we do a video consult, and then the follow-ups we do via phone, and we have an app that people can use to communicate with us between appointments and take pictures of their food. So, all right. No questions on that. So the next one are people getting enough fiber in their diets to keep their gut healthy? So Americans, no, on average, the recommended daily intake is 25 grams of fiber for women and 38 grams for men. So just kind of think in your head, or even put it in the comments, what do you think the average American is getting? So
like 10 to 15.
Yeah, 15. So it's less than half the recommendation. And now guess how much hunter and gatherer tribes are estimated to be getting?
Ooh, 40.
Over 100.
Oh my goodness. Wow.
I know. And their rates of chronic disease are so much lower too. And I know with a lot of this, as you guys know too, there's so many factors, but that's a pretty significant difference. And then the next question kind of ties into this, and I think you guys will find some of these statistics interesting, but Mackenzie says, colon cancer runs in my family. My grandpa passed away at the age of 43 with it. Is this something that's hereditary? My whole family seems to still have gut issues in general, even when taking probiotics, antihistamines, cutting out a lot of dairy, etc. So I really believe in the power of epigenetics, where we can use our food and lifestyle to kind of modulate and change our genetic expression. And with this, I know we're going to be learning a lot more about this in the coming decades too. But I would really, since a lot of your family is having gut issues, kind of dig into that, because I think that's going to be key in thinking through what the root causes might be to help decrease the risk of colon cancer. And something I wanted to share that's really practical that you can do right away is that we know that by every increase of 10 grams of fiber daily, it decreases the risk of colon cancer by 10%.
What?
Yeah, so that's like a cup of beans has more than 10 grams.
And you know what most people go for is like Benefiber.
Yes.
And yeah. What's your recommendation when somebody is like, okay, how do we get more fiber?
Definitely do food. You're getting so many other benefits from food that you're not getting from those fiber supplements.
Yeah.
Yeah,
That
unless
looks like
yeah, there might be select cases with clients where I'll use supplementation like that, but for the general public, start with food. And then to add to that, 3 servings of fiber to the diet each day can provide a 20% reduction in risk. So one serving, that's like half a cup of cooked vegetables or 1 cup raw.
So kind of to lead Alina, one of my friends just said I'm RA, and I've heard that going paleo would help. What are your thoughts on rheumatoid arthritis?
Yeah, it certainly might. There's definitely a lot more to it as well, but with arthritis, RA, it can stem from gut health. And if you're having food sensitivities to certain things, like a lot of grains, for example, then going more paleo and really upping the produce with all those anti-inflammatory benefits could help improve the RA. But it's not a one size fits all either. There's a lot of other components that I think of when it comes to RA as well. And then, to tie it to the fiber too, I do have a YouTube video up that's titled "Does Fiber for Digestion Really Help?" And I go into more depth about what we just talked about. So if people want more practical, how do I add more fiber? What does that look like? We even have a day example meal plan on that video that could be helpful.
I'm trying to find it here.
And then, because you can probably link it in the comments, huh?
Yeah.
Awesome. All right, so I don't see any other questions. We'll just hop to the next question. If I do not eat meat, will it benefit my gut? So kind of thinking vegetarian, vegan. So actually, it might do the reverse. We have research showing that vegetarian can make IBS worse. And it makes sense from my perspective as well for a number of reasons, but one of them being with people with gut issues, a lot of times there's malabsorption that goes along with that. And so I'm always thinking, how can we eat the most nutrient-dense foods to have the best chance at absorbing the most nutrients? And with meat, I think, a lot of Americans do eat more meat than they really need, but at the end of the day, there are nutrients that we get from meat that it's just hard to get in other ways, especially if we're using organ meats. Organ meats can be a really dense source of different nutrients. So I would say I would discourage going vegetarian vegan, but I would encourage using meat more as a condiment and if able, focusing on organ meats, which a lot of people aren't incorporating, but they're just so packed with nutrients. On the other hand, for somebody having like an irritable bowel syndrome, so gas, bloating, some pain, it's the room for diagnosis is how the criteria is how they diagnose it. But one eating plan is called the low FODMAP that can really help with symptom relief. So it's been shown that with 75% of individuals doing low FODMAP, they experience improvement in their IBS. Now, I will say a disclaimer, that's not an eating plan that you want to stay on long term because it could actually start to not be helpful for your gut health. So really having to reincorporate the foods in a smart way and then think about what the root causes are too. So that those would be food intolerances. They're just these fermentable carbs and foods that you can have food intolerances to. And if somebody, for example, has SIBO, they might have more intolerance to those FODMAP foods, but just avoiding them for life wouldn't be a good solution because you want to think about the root cause and, take care of that SIBO, for example.
Wow, my mind's blown right now. And I think I found that video and posted it.
Oh, awesome. Thanks, Taylor. And so with the FODMAP, I'm actually working on a 2 to 3 hour workshop that I'll share once I complete it. So if your followers are interested, they can follow on Instagram or YouTube and they'll definitely see it. But it's, again, like a good starting spot in that workshop. That's going to be the goal too, to help people just improve their quality of life, and then we can take it to the next step and think through those root causes more and really, really optimize the gut health.
Yeah, absolutely.
All right, well, let's just keep rolling here. So probiotics, lots of probiotic questions.
Give us your probiotic knowledge, please.
All right, so we have, what is your favorite probiotic, prebiotic for kids too, what to look for in a probiotic, best time of day, and then infant gut health. And also natural acid reducers for littles. What foods are known to help acne cavemen? Okay, cool. So I'll start with kind of a big picture because I like to think big picture than take it down because I think it's just easier to understand. And so we have, you guys, 300 to 500 unique bacterial species in our gut. That's what we, at this point where we are in our medical knowledge, understand. And we only have tested a few dozen of those. So I just wanted to say that because we still only know the tip of the iceberg. I'm really excited about functional nutrition and kind of the outcomes we're getting in our clinic. But at the same time, there's so much we don't know that we're going to be learning in the years to come. And so with probiotics, I'm sure your followers and a lot of people are really confused about it because they read one thing online and it contradicts the next thing. And I mean, that's why. That's why. Because people have kind of their opinions, but at the end of the day, there's so much we don't know still. And so one thing I wanted to mention before we kind of dive in further is that if somebody's having gas and bloating, I find sometimes they'll want to try a probiotic to get rid of it. And I just want to let them know that that's usually not the answer. It's usually not going to work. So you can just kind of save your money and use a different solution for that, like we talked about with the FODMAPs. So for individuals who are overall healthy, I would say just try to get these beneficial bacteria from food by using fermented foods. And so with fermented foods, they, in a tablespoon, have trillions of bacteria versus the probiotic supplements have in the billions. So if someone's looking to just kind of maintain their health, but they know it's important to have some of these probiotics, then fermented foods are a really great option. And using 1 tablespoon at 2 to 3 meals a day. My favorite is Bubby's Pickles. And then also there's sauerkraut. Look for live active cultures on the container. And usually they're more cloudy, and that's a good sign that they're fermented. And then like our local co-ops and Whole Foods and stores sometimes have a section devoted to fermented foods. And if you're my friend Emily, who is kind of a meal planning specialized dietitian, we're going to create a video on Friday showing how you guys can ferment your own vegetables at home.
Wow.
So if anybody's interested.
Do you brew your own kombucha? Do you brew your own kombucha?
I do, yeah. I've been doing that for so long, like since 2013, I think.
Wow, Katie, that's how we met you guys. Katie, my sister-in-law. She got me started on that.
Oh, I love it. Are you still making some?
Yeah. Well, when I had my son, which he's like 1.5 years now, so I have no excuse, I let my SCOBY, I let him die. So I need to find a SCOBY from somebody, or a piece of a SCOBY and start over. I know. Well, it's terrible.
I will say, if you've been fermenting kombucha, fermenting vegetables is going to be a piece of cake for you.
Okay.
It's easier.
That's good to know.
Yeah. And so I do use probiotic supplements still, though, and this is how I go about it. I look at the individual and kind of what they have going on, and I'll use a database that I pay for, a probiotic advisor, that lets me kind of more easily sift through the research. And then I can find one that's going to be aligned for kind of what they're dealing with and more likely to work. And then we'll trial it for 2 to 4 weeks and make the decision if we should continue or not. Because the thing with probiotics is that you have to keep taking it to keep getting the benefits. So it's not something you just take for a month and have like lifelong benefits from it. Yeah. So If, for example, like if somebody has histamine intolerance, some bacteria can make that worse, and some bacteria strains can make that better. And so it'll be important to pick one that has more of the strains that can improve that.
That's so interesting.
Yeah, and so another YouTube video that I have, are probiotics with antibiotics a waste of money, question mark. There is some research showing how probiotics can help to decrease negative symptoms from antibiotics. And then under that video, I do have a link for kind of a more general probiotic that I like to use.
Okay, thank you. I'll post that.
Awesome. And then time of day, I usually say empty stomach before bed, but honestly, it's not a hard and fast rule. So whenever somebody is going to remember it and be able to be consistent with it. And then what to look for in a probiotic. So one more thing I haven't mentioned yet is that the therapeutic effects, so the amount that's going to show a benefit to somebody, is different for the different strains of probiotics. So for, sometimes people say you need 10 to the 10 or 10 to the 9 or 10 to the 7. Well, it's different for every strain. And so really kind of over 10 to the 9th colony forming units is usually going to be therapeutically effective. And then just the quality of the strain more important than quantity. All right, and then 2 more quick things related to this. Prebiotics. Same with fiber. I encourage getting that from food. And so prebiotics, like soluble fiber and resistant starch, so like beans and a lot of produce, there's some soluble fiber. If anybody eats bananas that are more to the green side, that's a good source of resistant starch. If somebody is heating potatoes and cooling them down and eating like a cold potato salad, then that's a really great source of resistant starch. So these foods, they actually are eaten by the bacteria in the gut, and that bacteria produces butyrate. And butyrate is the main fuel for the cells of our gut lining. So it can really help to decrease inflammation, heal the cell lining, and there's research showing it helps with all over body inflammation as well. And then the infants, something a lot of people don't know is that breast milk actually has probiotics and prebiotics in it.
Wow.
So
of course it does.
Yeah, it's Mother Nature. So that would be my recommendation. If somebody can't, then checking with their provider on kind of what to do from there, because it's going to be different for every infant. Oh yeah, Taylor, how long should you let your gut rest without food? That was on my notes. So what she's referring to is every few hours we have this large sweeping wave that comes through our gut called the migrating motor complex. And that comes through in the fasted state, so when we're not eating. So it's recommended that we have about 4 hours between meals to help with that motor migrating complex to come through, which can help to prevent like a bacteria overgrowth and help to, as somebody's working to get rid of it, that's an important component piece of the whole plan to help get rid of it and keep it away, because the reoccurrence of SIBO is pretty high.
And then what about at night? Okay, so intermittent fasting is such a fad right now, but I do see the benefit in allowing yourself like time at night to fast. So what's recommended at night more than 4 hours then?
Oh, it would happen overnight too. So
okay.
Yeah, because
so there's not a certain like 4, 8, 12-hour window that we need at night. It's just as long as you're getting that 4-hour window.
Yeah, exactly. And if you go longer than 4 hours, it's still going to happen. So you don't have to like eat every 4 hours. It's just kind of being in that fasted state for that long.
Okay, cool. Yeah. That helps me a ton.
Good. And then Elena, what foods are known to help acne? So acne, great question. This is a really bigger conversation. It's really improving gut health from a lot of different arenas. So if somebody is having food sensitivities, like for example, dairy is really common for triggering acne. So then cutting out dairy can help, but then at the same time, thinking about, how might we try to optimize the gut to then improve the health of the gut lining to maybe decrease these food sensitivities. And for some people that works. So is the stomach making enough stomach acid? Is the small intestine absorbing properly? Et cetera, et cetera. And so when thinking of something like acne, just it's a really much bigger picture than just one food because it's really kind of different for everybody. So you can do an elimination diet and kind of see if that helps or go about it from working with a practitioner. And that would be a great topic for me to make a YouTube video on so I can kind of dive deeper into it as well.
Everyone should go and follow her on YouTube right now. Oswald Digestive Clinic.
Yes. Thanks, Taylor.
Yep.
All right. Acid reducers for littles. So there is something called gripe water that can be helpful. And just my disclaimer again, this isn't a recommendation. Check with your healthcare provider, but look into that, GRIPE water. And then if it doesn't get better, just thinking through other possible root causes, and it's going to be slightly different for everybody with acid reflux. But this was another question. So natural remedies for acid reflux. I am getting so bad with PMS. I couldn't even eat yesterday. I tried baking soda and water. It didn't help much. I am so sorry. This is a great question though. So the first thing is really thinking about really going big picture and seeing if you can connect any dots to the acid reflux. So my question would be, how bad is it when you're not having PMS, or is this something tied to PMS? Are you getting gas and bloating through the day too? Are you on certain medications, like a stomach acid medication and other just questions like that to try to connect the dots between what might be triggering this. But if someone is just in general having acid reflux, then there's a few things that we can do to help that. So it comes down to food triggers and then lifestyle changes. So with the triggers, the common food triggers for that include spicy foods, garlic, onions, tomatoes, acidic fruits, alcohol, coffee, mint, chocolate. Some lifestyle changes that can help with acid reflux would be decreasing chronic stress, avoiding tight clothes, smaller, more frequent meals, having fluids between meals, and then chewing gum 30 minutes after eating, but don't do mint gum, and then elevating your bed at night. Now, if somebody is having acid reflux with the gas and bloating too, then I would want to dig a bit deeper into that small intestine, and it might be that there's like a bacteria overgrowth causing a lot of this gas that's then coming up into the stomach and causing the acid reflux. And so just to kind of give you guys a idea inside my mind where I would go with that. But if it were a client, they would have filled out a full intake form, and it takes them about an hour to fill out. And then that allows us to, Marcy and I, to really review everything and have just a better idea with connecting dots.
That's great.
And so let's see, where are we at time? Oh my gosh, it's 9 already. Whew, time flies when you're having fun. All right, so let me try to cruise through some more of these. Thoughts on kombucha. Is it good for your gut health or too much sugar? So kombucha does have potentially beneficial bacteria in it. And for some people, it's not tolerated depending upon what's going on with them, like if they do have a histamine intolerance, for example. And so I encourage fermented vegetables more than anything. But if doing kombucha, you could consider doing the kombucha with the chia seeds. And those chia seeds are going to have some protein and fats in it to help to balance out the blood sugars, just for more consistent energy and mood through the day. Just really embrace that mindful eating, tune in. And if you don't feel well after it, then it's not tolerated by you. But otherwise, it's perfectly fine. All right.
Ooh, a loaded question there.
The errands?
Yep.
Oh yeah, eliminating dairy helps improve my skin drastically. Actually, that was my experience too many years ago with my acne. So dairy is kind of a biggie there. Are there any nutrient deficiencies for a healthy gut that I should be concerned about since I have completely eliminated dairy, or is my probiotic likely sufficient? So with cutting out dairy, the biggie that people get concerned about is calcium. So just really being diligent about getting calcium from other sources, from the non-dairy sources. Other than that, I don't have a lot of concerns with not having dairy in the diet, but of course I would have to see kind of what everything else is like to be able to really pin out nutrients. Oh, one thing you could do actually without having me look at it all is you can type your food into Chronometer for a week, and that'll actually show you the micronutrient content of your foods. And at the end of the week, you can see if you might be low on a certain vitamin or mineral, and then try to just incorporate more of those foods.
Okay, what is that? Can you spell that out?
Yeah, it's Chrometer.
Exactly. Okay.
Yeah.
Got it, Erin.
Awesome. And so, but it's a good point with nutrient deficiencies, going back to what I mentioned about when people are having gut symptoms and not absorbing properly, and maybe they grew up on like a less nutrient dense diet, it's really common to get these deficiencies. And so I just wish as a part of our medical system, we were testing everybody for vitamin and mineral deficiencies, but we don't. So either as a practitioner, I'll connect dots. For example, I had a client once who had a history of drug and alcohol abuse, and I know that can deplete magnesium from the diet, from the body, and so he was having headaches. And so I knew it's safe to replace magnesium, and it actually got rid of his headaches.
Wow.
Yeah, so testing is awesome, and if you don't have access to testing, sometimes I'll say trial a multivitamin, but again, I can't give like those recommendations because a multivitamin might be dangerous for a person. So awesome, good. I'm glad that was helpful, Erin. And then, oh yeah, Susan got it, Chronometer. All right. What are other ways to help heal your gut besides taking a probiotic? So kind of goes along with what I was just saying. It's a great question, a broad question. We think food supplements lifestyle with gut health. It's if you ever hear somebody say, you know, they have their gut health protocol, and if you sign on as a client, they're going to take you through their protocol, like go the other way, because there's no such thing as one protocol working for everybody to get rid of gut symptoms. It's just not true. So I want to share just kind of 3 stories to show you how very different it can be. One is I was speaking and messaging this individual on Instagram. Just I was kind of pulling questions for this new Q&A series I have on YouTube. And he told me he was struggling with getting gas and bloating that got worse during the day. And so we just kind of talked through it, and I said I'll make this video and kind of give some ideas there. Well, I touched base with him since coming back from some travels, and since being in physical distancing, his gut symptoms got 70% better because he's now eating on a schedule, eating real foods, cooking more, and just not doing as much kind of processed and drive-through foods.
Wow.
Yeah, so for him, I mean, that's amazing. And then I have clients who come to me tolerating, you know, less than 20 foods, and we have to go to like an elemental or semi-elemental formula to start and kind of work our way up from there. And then I had one client where her gut symptoms actually had nothing to do with food, and it was just stress. And she went away for a weekend with her family, and about 90+% of her gut issues went away. So yeah, that's why kind of I say nutrition's like half science, half art, because the art and having that intuition and be able to connect the dots and, you know, figure out what some of these root causes might be is as important as knowing all the science. But kind of big picture, what I would start with, kind of when people ask me, okay, what's general eating for like a good gut? Somebody not having a lot of symptoms, I usually say like eat real food, kind of think about what your grandparents were eating, think about what your farmer's market has, a lot of color. We talked about some organ meats, and a book that I really love and I think a lot of people might find interesting, especially in kind of this culture that we have with all these like yo-yo diets. And I just think eating should be fun, and I really want to help break people out of these yo-yo diets. But it's called the Blue Zones. Have you heard of that, Taylor?
I haven't.
So it's these, I think it's 5 areas in the world where people are living past, a lot of people are living past the age of 100 and in a healthy way where they're still like living their life and still like capable of doing what they enjoy doing. And it just showcases kind of what their eating's like, what their lifestyle's like. And I think it's just really eye-opening to see that, yeah, there's this area in California that's a blue zone actually, and they're vegetarian and don't drink. And then there's this area in Italy where they do have meat and they do have some wine. And they both have like very healthy community members.
The Blue Zone?
Yep, the Blue Zone, and the name of the author is not at the front of my mind right now, but the Blue Zones. And then the last thing is I do have another YouTube video up. I actually can just copy and paste into the comments. That's the title, 7 Things That Can Knock Digestion Out of Whack, and that might be something more that can help answer your question, Jamie.
That's great, thank you.
Yeah. All right, so how do you know if gas and bloating issues are related to gut health? So I would just kind of tune in and try to connect dots again. So for example, if somebody is like eating a lot of beans and they're not properly cooking the beans and they're having triggers to the illegal saccharides because they're not properly soaked and cooked, you know, that can cause gas and bloating, but it's not like that would happen to anybody. Or if somebody is just getting a little bloated around their period, maybe when somebody's more stressed, the gas and bloating gets worse. But I would say if you're having gas and bloating pretty consistently and it's like getting worse during the day, then definitely look into that and get connected with a dietitian, nutritionist. All right, and then testing, it can definitely help to give us more information too. Okay, so how can you tell if your gut lining is damaged? There are many tests. I will say if somebody's having autoimmune issues, I always assume there's something going on in the gut until we can prove otherwise, but usually there is. There are a lot of tests that can be done showing intestinal permeability. And I'll just name the tests, and then if you guys want to dig into them deeper, you can, just for the sake of time. But there's a urine test, the lactulose mannitol test. There is a serum, the lipopolysaccharide. There is zonulin, which is has been tied to increased intestinal permeability. I should back up. That lactulose and mannitol test, so basically what that is mannitol is a small molecule, lactulose a large one. So they test the urine, they can show the ratio of what's getting past the gut lining. So the large ones shouldn't be getting past as much, the mannitol, yes. So then with that ratio, it can kind of give us an idea as to what might be going on. And then there's citrulline testing, and then there's fecal secretory IgA, which isn't as much for the intestinal permeability, but it can show if there's an increased risk of damage and just kind of disruption to the health of the lining.
I was trying to take notes and write all those down, and I just, we'll look those up after.
Oh, yeah, I should have been copying and pasting over. So I'll keep the main one there, and then this guy. Yeah, and then two. So, all right, so can food allergies be gut health related? Oh, this is so interesting. I'm glad you wrote this down, Taylor. There's actually a study going on in Australia right now where they released preliminary results. I think if I'm remembering right, it was 50 individuals. But what they did is they took And I think it was only kids, but they took these kids with food allergies and they took the allergenic food and they cleaved it to a probiotic. And what they found was the immune system recognized the probiotic as helpful and then recognized the food as beneficial. And there is a significant reduction in food allergies after the treatment. So right now they're going through a larger study on it. It hasn't been released, but I think that's really promising.
That's crazy.
Yeah.
And exciting.
So exciting. What other common ailments are typically gut health related that we might not know about? So insulin resistance, some research there, joint disease, as we talked about, rheumatoid arthritis, depression might be, not always, but asthma, acne, eczema we talked about already, Hashimoto's, and a lot of those other kind of chronic inflammatory diseases. All right, let's see. I might have to skip over some of these guys. I'm trying to find the ones that might be most helpful. So this one is kind of like more of an interesting one that you guys might like. My 13-year-old daughter has always had rough, bumpy skin on most of her body, but most noticeable on the back of her arms. I asked her pediatrician about it multiple times, and she was an infant toddler, and she insisted it was just dry skin, but she still has it. Is this possibly caused from diet, gut health, allergy? She uses homemade soaps, crunchy face soap, and I use Zoom laundry soap. Awesome. Good to rule those out. I don't think this is just a topical issue. So I've actually seen this go away in some clients, and then other clients it might get better but not totally go away. But when we look at the research, if your doctor has called this follicular hyperkeratosis, and I can type that into the comment here. So if that's what it's been called, we have research showing that vitamin A deficiency can be a root cause of that. Low essential fatty acids, so that would be, you could up flaxseed oil, fish oil, cod liver oil, vitamin A, low B vitamins, low vitamin E could all be contributing to that. And then a low thyroid function could also be causing it.
I can make a testament to that. When I up my omega-3s, all of it goes away. It's so crazy.
That's so cool. Mm-hmm. That's so cool. All right. So there was one about constipation. A fiber gummy was helping, and for the sake of time, I'll say if that fiber gummy was helping, then try incorporating at least 25 grams of fiber. This is a 3.5-year-old, so shoot for at least 25 grams there. And then you can also try some prunes or like cherries and pear juice, ground flaxseed, all helpful for constipation. And just start there. There's a lot more to it, but yeah, I would kind of have to know more information. And I also want to share that I'm working with an occupational therapist on a book about pediatric constipation that we're going to be releasing on Amazon. So hopefully in a couple months here, we just started working on it. So that would be definitely be sharing on Instagram. So if this individual follows me there, might be helpful. Okay. So there's a question about a rash. Okay, yeah, I wanted to get to this one too, and then I'll see if there's any other questions over there. So if you guys have questions, like thank you for joining live, and please just jot them over in the comments. So this one is, my husband has been suffering from a rash that looks like eczema, and I'm telling him that he needs to work on his gut health. What advice do you have? She started convinced him to do the whole 30 with her. They're on day 5. And then somebody else asked, could eczema be tied to a histamine problem? Could taking antibiotics as a kid contribute? And then just experience about a product called Florazone. So Florazone, it's homeopathy. I don't have experience. It seems pretty safe, low risk. I always weigh potential benefits to risk. So I hope just hearing that is helpful to you. Whole30, great tool to see if food is triggering. And if that's the case, then I would say just take it a step further and think about why somebody might be having those food intolerances and sensitivities. So maybe as simple as not chewing well enough, but maybe somebody is not making enough stomach acid. Maybe they have some inflammation. Maybe they have a bacterial or fungal overgrowth or, et cetera, et cetera. Antibiotics as a kid, something interesting about antibiotics that we know is that a 2-week course could disrupt the gut microbiome for over 2 years. Yeah, and certainly antibiotics are really needed sometimes, but there's another video up on my YouTube talking through this more. But yeah, just be really, work with your doctor and be smart about using antibiotics and only when absolutely needed because of that. And so that certainly could have been the case. Histamine intolerance, it can be because of dysbiosis, because of the gut bacteria. And there's something called DAO enzyme that helps to break down histamines. If you wanted to try, I would just kind of cut out the fermented and aged foods and see if that helps. But then I always like to think about what can we add to help get rid of issues versus being so restrictive with foods. So there's also foods and supplements that can help to improve tolerance and then also help to break down those histamines better, like vitamin C, for example. But a really simple thing with histamines to start with is just work really hard to eat your food fresh. So if you're batch cooking, freeze it right away. Don't let it sit in the fridge and see if you notice an improvement with that. That alongside limiting fermented and aged foods. And then lastly, with the eczema, I just want to share what we have regarding the research around eczema. We know that identifying and avoiding allergenic foods can be helpful. So the fact that you guys are starting with Whole30 makes total sense. Low fatty acids can be contributing. Zinc, low zinc could be contributing, low vitamin A, and then it has been shown that pancreatic enzymes can be helpful in certain cases too. Awesome. I'm just looking through the comments. Well, thanks, Lindsay. I'm glad that you'll be joining me over on Instagram and okay, some longer ones. Okay. I take Juice Plus Complete drinks once a day and take their plant-based capsules, and the companies and feelers and need to take multivites. So I don't accept I take calcium and magnesium as I have osteoporosis and I'm 71 and healthy. Oh, and I take daily elderberry syrup. Am I good? Oh, it's such a great question. I wish I could look at your intake form to answer that. It really depends on the person. I can't even really give a recommendation without knowing even more information. I will say with osteoporosis, I would think about having some K2 in there too, making sure your vitamin D status is optimized, and then some of those other minerals that can help with bone health as well. So there's a product Pro Bono I like to use. Again, these aren't recommendations, just information. Check with your healthcare provider, but that's kind of my go-to for bone health. Pro Bono, I think it's Orthomolecular makes that product. All right, did I get all the questions, Taylor?
Yeah, I think so. I think you hit them all.
Okay.
Yeah, Lana's the prettiest person on the planet, so I'm glad she's on here.
Oh, I hope you guys like that. I feel like I was just rambling so much versus a conversation. So I'm glad to see these comments that it was helpful.
Yes, you had some pretty specific questions regarding SIBO. One of my best friends just got diagnosed, and she's trying to decide what route of treatment would be best since I already try to live about 90% AIP. So I think we could dive into these, but it's totally up to you.
Yeah, I'm happy to answer all these. I appreciate you guys taking the time to make the comments. So let me see where I left off. Okay. Yes, so what's your best route to heal SIBO? I just got diagnosed with this, trying to decide what route of treatment would be best since I already tried to live about 90% AIP. And so, such a good question. And it really depends on the person too. So I'll say a story. I had a client who was diagnosed with this at Mayo, and this person really wanted to try the herbal route. We do have some research showing that the candidactin products are as effective as the antibiotic. And so we sent that study over to her Mayo doctor, and her doctor gave the okay to use the candidactin products and just to monitor and see how the symptoms improved on it. So I always like to go to the side of using herbals, but I'm a dietitian, so I don't give medication recommendations. So I can't really speak there, but really the goal would be to use something like that to get rid of the SIBO and then really hone into those lifestyle approaches and some of the other approaches to really optimize the gut health so that it doesn't come back on you. So decreasing chronic stress is so important. If somebody is on like a proton pump inhibitor to decrease stomach acid, we try really hard to work with the doctor to taper off of that because that stomach acid is really important for the movement of the gut, which is important for preventing the bacteria overgrowth from coming back. Keeping 4 hours between meals, as we talked about. And then if somebody, for example, doesn't have a gallbladder, then that's something we want to look into too, and really supporting the liver and bile production to help with the pH of the gut and just the environment in general. And so I don't know if she had like a specific question related to it, but I hope that that helped.
Yeah.
Okay, any pointers on strengthening your stomach sphincter? So we actually have two sphincters by the stomach. We have the pyloric sphincter on the bottom, and then we have this esophageal sphincter on the top. And so for the esophageal, it is thought that we need enough stomach acid to help to keep that one closed. So it goes back to if somebody's on a medication, decreasing stomach acid, really asking why, and is that something they really need, or were they put on it from acid reflux, and could that acid reflux be better managed with nutrition to help them taper off? And I've helped a few people be able to taper off PPIs, so it's totally possible. And then also it's thought that chronic stress might be triggering some of that low stomach acid as well. So thinking through if that's maybe a piece of your puzzle. If talking about the pyloric sphincter, that's really a sphincter where the stomach, it's very acidic. It's supposed to be very acidic to help break down our food, churn our food, and then it's trickled through this pyloric sphincter into our small intestine where a lot more of that absorption happens. So most of the absorption happens in the small intestine. And so I'm assuming he meant the esophageal, but comment if that's not the case. And then about the acupoints, I really don't know because I'm not trained in Chinese medicine, but I think it's certainly worth exploring and checking in with an acupuncturist. Okay, and my 13-year-old daughter has always had rough, bumpy. Oh, we did that one already. I think we got to them all.
I think you got them all. We just had one new one. When you talk about overgrowth, what are the symptoms?
Yeah. And again, I don't diagnose, but from doctors, functional medicine doctors I've talked to, they'll basically say that if somebody is having gas and bloating that gets worse during the day, it's a really likely sign that there's some sort of a bacterial overgrowth there. But we can also test. So testing, it's a breath test. It takes about 3 to 4 hours of like breathing into tubes. I think it's about every 20 minutes. And we can then see kind of the gas production, and based upon the curve of when the gas is being produced, we can see if there's too much bacteria where it shouldn't be. So most of our bacteria should be in our large intestine, but if too much gets up into our small intestine, it starts to affect the absorption of nutrients, of foods, and then also triggering this gas and bloating.
So helpful. Thank you so much, Ashley.
Yes.
I feel like we could sit here all night. I feel like the questions are just going to keep coming. So
I know. I could do this for days. It's like my favorite topic. So thank you guys. Thank you for being so engaged.
That's bomb. They're really great. Well, we are so appreciative, and I'm sure we will be getting more questions. And you guys, please follow her on Instagram.
Yeah, and YouTube. And if you have specific questions, shoot it over to me because, like I said, I started these Q&As on YouTube, and I'd be happy to if it's a question that I think would be helpful for a lot of people, you know, showcase it in a video.
Awesome. That's so great. Your YouTube channel is amazing.
Oh, thank you. Yeah,
Okay.
thank you too.
I think, wow, yeah, so much information on there, you guys. It's so, so good. I will paste that in here too.
The YouTube is Oswald Digestive. Oops. Oh, thanks, Taylor.
Yep.
Okay. And I think this we can download and I can upload it to the YouTube channel too in case you guys want to share this with somebody, right?
Great. Oh my gosh, thanks.
Yes. Yeah.
Okay, well, Ashley, thank you so much.
Yeah, thank you, Taylor. This was so fun. Thank you, everybody else.
I know this is a topic I feel like we're just scratching the surface. I don't feel people, myself included, really understand it and are capable to understand it without someone like you. So we're just super thankful that you are willing and able to, you know, share your knowledge with us. And there's just so much more we need to learn, for sure.
Yeah, 100%.
All right, thank you so much. Should we close it out, or do you want to wait and see if anyone else has questions?
If anybody has a question, just quickly type it in. But I think this looks good. And let's we can always do another one of these in the future if, you know, people come
Sounds
afterwards
good.
with a bunch of questions.
Sounds good. Okay, I'd love to.
Awesome.
Well, thank you so much.
Yeah, thank you guys too. Have a great night.
You too. Bye, Ashley.
Bye.